You've been told you have lumbar spondylosis, but what if that diagnosis is far less alarming than it sounds? Welcome back to this series on low back pain. Drop a comment below if you've been given this diagnosis and what you've been told about it. Okay, let's just get right into it. For so many of us, you get that imaging report, you see these words like degeneration, wear and tear, or spondylosis, and it can be genuinely terrifying, right? It sounds like your spine is just crumbling or falling apart, but I'm here to tell you the evidence it paints a very, very different picture. So first things first, what is lumbar spondylosis? Instead of thinking of it as a disease, think of it more like a descriptive category. It's really just an umbrella term that covers the completely normal age-related changes that happen in everyone's lower back over time. We're talking about things like discs changing a little, maybe some bone spurs popping up, and the facet joints just aging. The most important point here is this. It's a description of what a spine looks like at a certain age, not a diagnosis of some painful condition. Now, we've got to clear something up because this causes so much confusion. Spondylosis, spondylolysis, and spondylolisthesis, they all sound almost the same, but trust me, they are completely different things. Spondylosis, that's the general aging stuff we're talking about today. Spondylolysis is a very specific type of stress fracture. You often see it in younger athletes. And spondylolisthesis, that's when one vertebra actually slips forward on the one below it. So it's really, really important we don't mix these up. So what's really fascinating is the science that completely backs this up. There was this landmark study back in 2015 by Brinjache and his team. They did a huge systematic review, looking at the scans of thousands upon thousands of people who had no pain whatsoever. And their conclusion? Well, it pretty much changed everything we thought we knew. It suggests that what we call degeneration is for the most part just normal aging. So that leads to the obvious question, right? What exactly did they find when they scanned all of these people who were walking around feeling perfectly fine? I'll tell you, the results are genuinely stunning and should give you a huge sense of relief. Let's actually look at the data. Okay, this is where it gets really, really interesting. Take a look at disc degeneration. If you scan a group of perfectly healthy, pain-free 20-year-olds, over a third of them already show signs of it. Now, jump to age 50. A staggering 80% of people, again with no pain, have disc degeneration on their scans, and by age 80, it's basically universal. Finding it on a scan isn't the exception, it's the absolute norm. And you see the exact same story with disc bulges. As we talked about in our previous explainer on this, a disc bulge is incredibly common. At age 20, about 30% of people without symptoms have one. By 50, that number jumps to 60%. See the pattern? These findings aren't signs that something is automatically broken. They're signs that time is passing. This is probably the best way I've ever heard it explained, and the most powerful way to reframe it. Think of spondylosis as the grey hair or wrinkles of your spine. They're just internal markers of time. I mean, you wouldn't think you have a hair disease just because you have some grey hair, right? So we shouldn't automatically assume we have a spine disease just because of these findings on a scan. So if these findings are so incredibly normal, why did it cause so much fear and anxiety? Well, this is where we have to talk about something called the nocebo effect. It's basically the evil twin of the placebo effect. Instead of a positive belief leading to a good outcome, a negative belief, often triggered by scary medical language, can actually make you worse. And the research is clear on this. When you hear words like degeneration, wear and tear, your spine is crumbling, it has a real negative impact. It ramps up your anxiety, it makes you believe your body is fragile and permanently damaged, and can lead to a fear of movement, which has a fancy name, kinesiophobia. This can kick off a terrible cycle of more pain, avoiding life, and then demanding more tests and treatments that you might not even need. And that's exactly why language matters so much. Just a simple shift in words can change the entire message, from one that makes you feel fragile to one that makes you feel resilient. So instead of wear and tear, let's say normal age-related changes. Instead of you should avoid bending, how about movement and relaxed motion will help? The goal is to reinforce that your spine is strong and adaptable, not broken and delicate. Okay, so the big question that's probably on your mind right now is, all right, if this stuff is so normal, are you saying my pain isn't real? Can these changes ever cause pain? And the answer is absolutely yes. Your pain is 100% real. The relationship is just, well, it's a lot more complicated than we used to think. For some people, these age-related changes can be a piece of the puzzle. For example, if those bone spurs or disc changes start to narrow the space where the nerves travel, a condition called spinal stenosis, or if they directly press on a nerve root, which we talked about in our explainer on sciatica, then yeah, they're definitely relevant to what's going on. But, and this is a huge but, the link isn't as direct as you'd think.
Studies estimate that for somewhere between 30 and 50% of people who actually have low back pain, the findings on their MRI scan don't directly match up with the symptoms they're feeling. There's a pretty big disconnect. So what's the bottom line here? It's this: a scan report is not a diagnosis. It's just one piece of information. To really understand what's causing pain, you have to put that picture together with a thorough physical exam and, more importantly, with your story and your specific symptoms. You always treat a person, not a picture on a screen. So if we stop obsessing over trying to fix what the scan shows, what does the science say is the best way to feel better? Well, the evidence is overwhelming. The old advice of just resting and avoiding everything, that's actually counterproductive. The modern evidence-based approach is all about taking an active role. It's about movement. The foundations for managing back pain tied to these changes are actually pretty simple, but they are incredibly powerful. Step 1 is education, understanding that pain is complex and doesn't always mean your body is damaged. Step 2 is movement, getting into progressive exercise to build a strong, confident and resilient back. And step 3 is consistency, just making activity a normal, regular part of your life. And that first step, education, is so important it actually has its own name, Pain Neuroscience Education, or PNE. Study after study shows that simply helping people understand the modern science of pain, that it's a protective alarm system from your brain, not just a simple signal of damage, is incredibly effective at reducing pain, disability, and that fear of movement we talked about. All right, let's start to bring this all home with what is probably the single most important message of this whole explainer. The long-term outlook for people who have these normal age-related changes on their scan is overwhelmingly positive. This is not a life sentence. Here's the key takeaway. The vast majority of people who have these findings live totally normal, active, and fulfilling lives. How much degeneration you happen to have on your scan has been shown again and again to be a really poor predictor of how you'll feel or what you'll be able to do in the future. So if you only remember one thing from all of this, please let it be this. Your scan is a picture. It's a snapshot in time. It is not a crystal ball. It is not your future. And that really just leaves us with one final thought to ponder. Now that you understand that spondylosis is more like getting grey hair than it is getting a disease, and that your spine is actually designed to be strong and to move, how might this change the way you talk about, think about, and ultimately care for your back? Thanks for watching.